and after 3 and 4 days you give a drug and that takes care of the cells, and you remove those cells which are likely to create problem later on. I want to talk about now 50% mass transplant, the German technique. So there is a difference. There are two types of 50% mass transplant. One is the American method or John Hopkins method, and then the other method is German. Why do we need either American method or German method? There is a reason. Because 50% match means 50% mismatch. Now the cells which are likely to create problem because of this 50% matching, how do you take care of them is the type of transplant. So in John Hopkins or the American or post-transplant cyclo or T-replete 50% mass transplant, you do the transplant, you do not do anything, and after 3 and 4 days you give a drug and that takes care of the cells which are likely to create problem. In German method, you remove the cells before transplant. So you collect the cells from the donor and then you pass them in a machine and you remove those cells which are likely to create problem later on, and that's what we call TCR alpha beta and B cell. So TCR alpha beta and B cells are the cells which create problem. So we remove them before the actual transplant, and that's what is the German technique or TCR alpha beta and B cell depletion. In thalassemia 50% mass transplant, German technique's outcome is better, complications are less, and post-transplant the drugs used are also less. So if you ask me out of the two type, American method or German method, which one is good? So the published data favor the German method is the better one.